Today we are faced with a multiplicity of options for wearable devices which promise to monitor our health and help us to detect disease early. How useful are these and what are we looking at in these devices? Wearable devices do contribute to monitoring our physical health. For example, you can monitor heart rate variability, you can monitor VO2 max, you can monitor your heart rhythm with wearable devices. To a certain extent, the data that is generated from wearable devices like watches and rings and bands, they are quite accurate. For example, even if the VO2 max that is measured by your watch is not the same as VO2 max that is determined by a rigorous cardiopulmonary exercise testing in the lab, it still gives you a trend of how your overall physical and cardiopulmonary fitness is evolving. And when you have a track of your VO2 max, if you see that there is a deterioration at some point of time, it could mean that there is some new disease, which could be like a low hemoglobin or a thyroid disorder or a heart disease or a lung disease or simply a lack of physical activity and therefore deconditioning. So it is not just the absolute numbers that are important, it is also the trend which helps us to understand in which way our physical health is moving. We have to be careful about hoping to diagnose heart attacks with these devices because we all know that even when we record a 12-lead ECG with a standard ECG machine, early heart attacks can be missed. So you do not expect a single channel or two channel wearable device to be able to pick up heart attacks. So if one has chest pain, do not depend on your watch to tell you that it's a heart attack or not. You have to go to the hospital and get a proper 12-lead ECG recorder. Can wearable devices detect arrhythmias? To an extent, yes. Apple Watch, for example, is certified for being able to diagnose atrial fibrillation. This is a kind of heart arrhythmia where the heart is beating very fast and irregularly. So the watch can detect and alert you that there is a atrial fibrillation. But it cannot tell you about other situations such as ventricular tachycardia or any other heart arrhythmia. If somebody has fainting episodes and if the person is wearing a watch at that time and during those fainting episodes, if a extremely slow heart rate is detected, then we know that the cause for fainting is what is called bradyarrhythmia or slow heart rhythm. So in this manner, wearable devices are sometimes a very practical and cost-effective way of monitoring heart health, as long as we also understand the limitations of the same. We have to be careful because sometimes they may generate false alerts which may prompt a visit to the hospital and then further downstream evaluation. But we have seen that in people who have intermittent symptoms like palpitations or fainting, a wearable device sometimes comes to the rescue of the diagnosis, because if you have to connect them on proper proprietary medical monitoring devices like Holter, you have time limitation. You can monitor for 1 day or 72 hours or 1 week or maybe 1 month, because the longer the monitoring, the more expensive it becomes. But if you have a wearable device, it gives you a better chance of having an opportunistic or a continuous monitoring which can pick up episodes which happen occasionally. So use your wearable devices intelligently and it becomes very helpful. Thank you.